something called DRP, that is the district rural posting. So you have to go to the rural district hospitals and you have to serve for a period of 3 months. Never mess with two groups of people, that is the nurse and the group D staff. Nurses, they are high on estrogen and without any reason they are not working that much also, and they could bash on you. This video is a complete guide to residency. Starting from first year, second year to third year, it is applicable for any residents throughout the country, maybe across the world also. Now, why it is necessary? Because the newspaper article you can see that 1270 dropouts are there in past 5 years, and there are 122 cases of medical student suicide. So it is very much important for the orientation of the post graduation, because most of the suicides and the dropouts, if you see, they are limited to the post graduates only. So let's start the video. And if you are new to my channel, then do subscribe. वो लाल वाला बटन में उंगली से दबा देना, बिकॉज तुम लोगों के उंगली के ऊपर ही मेरा भरोसा है. So things you need to have, this is a basic thing, is that you would be doing long duty hours, so you need to have some comfortable scrubs and a comfortable footwear, because you have to walk here and there. Sometimes you would have about 20,000 steps. So for that you don't develop any corn callosities, you need to have a comfortable footwear, and which should be covered to prevent any needle stick injuries, because in hospital it is very much common that some needle may be fallen here and there. So that would give you protection. From our first year of MBBS, our professors told that you should always wear a covered footwear. You can wear sneakers or Crocs for that matter. Basic thing is that you should have stethoscope, you should have the white coat of the college, and branch specific instruments. Like in ENT you should have a otoscope, in dermatology you can have a dermatoscope, at least a magnifying glass, like that. According to branch specific, you should have that things. And do join on 20th December, because it is the starting date. Later also you can join, but why I am telling that on this day only you should join? Because if you do late and you join later, then you won't have the option to explore the stream, the college properly. If you explore and feel that no, this college is not suitable for me, then in the third round you can upgrade also. Okay, you can choose another college, so you have the option open. Thus you should join on 20th December only. Coming to residency specific of first year, general advices: first is the sincerity. You should do all the tasks diligently. You could be slow, but you should complete the whole task, and you should not spoil the task in haste. Okay. Punctuality: you should reach on time, the time the residents, the senior residents are telling you to reach and the faculties are telling you to reach. You should reach on time. These two things are the most important factor to become a good doctor also, because these two things are the most important factors to become a good doctor also, because one of the external examiners also told me that these two are the building blocks for a good doctor. Ask: you are new to this college and this stream, you are exposed new, you are just an MBBS graduate, so it's okay to ask questions however silly it is. Max to max you might uh, be feeling yourself stupid, but the bashing or the backlash that you are going to face if you do a mistake without asking, you won't face that. Communication is the most important pillar. Okay, the most important thing is personal relations and work relations. Communicate well with your co-PGTs and the seniors. Like one of our RMOs also told me to take the history of cutaneous T cell lymphoma before it is transferred, but the patient was already transferred. So later sir asked me, have you taken? So I told that sir, it was transferred. Then sir told that, why haven't you communicated the same to me? Okay, so that's the necessary thing to build trust. uh, the communication is very much important, and you know that trust is the most precious thing, and cheap people can afford it. Learner: you should be a lifelong learner, being in the medical field, so you should carry a pocket diary. and write all the important information and stuff that senior are telling you, bombarding you, and revise it multiple times while sitting in the ward or while you are free during the college hours. Only try to revise the same stuff. Be humble and always respect. If you give respect, you would get respect in return. Don't quarrel with your seniors and professors. Okay, maintain a good composed appearance. Safety first, always be vigilant and follow the safety precautions. Don't think that I don't have that much of time, or this patient is not going to turn seropositive. So in my experience also, when I was giving intralesional steroids, that is, in a lesion we directly inject steroid, so many patients come. And that time also one patient came, I recently opened my gloves and I thought that without gloves also I can give. So I tried to give and it pierced my skin. Then I had to do all the serological test and it was negative. So the basic funda is safety first, even if it is taking time, but your safety is the utmost priority. After that, I always wear gloves and give the intralesional steroids. MR dealings, the clinical subjects, if you are in the clinical subjects, medical representatives would approach you, but be vigilant while dealing with them and don't be over frank with them. And if your department doesn't like, your HOD doesn't like dealing with the medical representatives, then try to avoid. Okay, and don't take things and what people say or what professors say too much seriously. Don't take it to your heart, take it easy. Okay, don't if they are scolding you, don't take it to your heart. At the end of the day, they are the same people who would guide you. Now, if you haven't got any college yet or you are planning to join some other college, then all the counseling related and college related informations, especially the deemed colleges, you can get in College Storia. Their website is www.collegestoria.co.in, and this is their calling number. You can call. Their counseling advisors would guide you and would help you to make a good choice. After that, coming to the specific advices for the first year residents, now I have divided them into two groups. One is the hectic group that has more than 70 hours per week duty, and the academic group that is less than 70 hours per week duty. So if the duty hours is less than 70 hours, then you can focus on your academics, and if it is more than 70 hours, you can't focus on your academics. I have divided in this way because, see, dermatology is an academic stream, but in Delhi based colleges the duty hours reach from 100 to 110 hours, so you can't focus on academics. So according to the duty hours, I am classifying. You see how much is your duty hours and you fall in that category. Coming to the hectic group, your aim is just survival of the first year. After the first year, everything would be falling in place. This time the first year is extended to 14 and 15 months, but maybe not the next year. So your aim is just survival. Just do your duties, try to get some sleep in between, do all your daily course, like नहाया नहीं 7-8 दिनों से, ऐसा मत करना, ठीक है? That would make you more gloomy and more depressed. And don't try to study much and or much of your thesis work. Just submit your thesis and all. Always carry some dry fruits, protein bars, some kind of healthy food, because if you are not able to go to the canteen so that you could have the food, don't just go to duties and suffer from hypoglycemic attacks. And try to sleep at any time possible. Okay, make an habit to sleep at any time possible, anywhere possible, because of your hectic duty hours. Number two is the academic group. This academic group, you should focus on academics. So saying academics, you should focus on the thesis topic. Try to choose a rare topic so that you could publish your thesis only at a good journal, and that could build your CV. Start reading books, and the things you witness, like in dermatology you see a vitiligo case or you see a tinea corporis, go home and study about that. You would have a very much broad idea. Like I also used to see patients and I didn't have that much of idea, but when I studied the atopic dermatitis, I learned that I have to counsel the patient to bath them regularly and also in a warm bath and using scented baths, not the normal soaps, because that is going to cause more dryness. So I am applying the same while prescribing my patients and explaining my patients. Like this, you would be interested in learning also, and you could give a better patient care. Do at least 3 more studies along with your thesis topic. Till now I am not doing, I am not getting that much of time, but you should do at least 3 more studies apart from your thesis uh, topic, and try to publish them, do oral and paper presentations on them. Then your CV would be strong, because now in any private setup you want to establish or you want to go to the foreign, then your CV is mandatory. And how would they differentiate you from other graduates is the number of publications and the quality of publications that you are doing. So try to build your CV from the PG ship itself. Take part in oral and poster presentations. Coming to second and third year, it is more or less academic group only, because in the first year it is very much hectic. The hectic group also turns into the academic group in second and third year. So first year is just survival for this hectic group, second and third year is more of the academic group. Now in second year you have something called DRP, that is the district rural posting. So you have to go to the rural district hospitals and you have to serve for a period of 3 months. That time the duties hours are less and you get more time to be at home and you could study. So that's why from second year only it is academic oriented. Now focus on your thesis topic and research. Now you take the samples, you do all the necessary stuff, you compile them, and in the third year you complete your thesis also. Do all the procedures. In the first year you just follow the advices and try to do the small hands on that you get, but now try to do all the mastering, all the procedures that you are seeing, and master them. Number 3 is you should start preparing from second year for the MD exam and write the answers of all the previous year questions, make them in your notes and write down the answers. Okay, that would help you in your MD exam. And always be the senior that you wanted as a junior. Then only you could guide them properly also, and they would also have a good connection with you. Now coming to the pro tips, I have kept some pro tips for the extraordinaries who don't want to be the ordinaries and they want to excel and be popular as a resident. So know everyone's name. Everyone's name is their favorite word and their name is unique to them. It has a special emotional attachment. So keep a pocket diary. I do it always. I keep a pocket diary and note the names even of the interns, guards also even. Okay, I remember the name, and sometimes while calling, like there is a guard near a lift, Michael, named Michael. So I tell Michael, the how are you? And he feels very much joyous because I remember his name. If a superior remembers your name, you would feel himself important and he could be helping you in some purpose. Similarly, if you know every intern's names, don't try too much hard. Try that how much you can remember, then you would become a popular senior. You would become a popular person in the college as a whole, and you would have influence in the college. The second is that you should greet everyone good morning while you are entering the college. The hospital is the thing that you are going to stay for 3 years, so why not make the environment also good? Now if you smile and say good morning, the person would smile and say good morning to you. And practicing this for 7 to 8 days, you would see everyone around you smiling and greeting goodbye. I also did the same thing, and now most of the guards and seniors are also telling good morning to me. uh, main advice is that never mess with two groups of people, that is the nurse and the group D staff. Okay, never mess with them. Have good relations with these two groups of people in the hospitals. Nurses, they are high on estrogen, and without any reason they are not working that much also, and they could bash on you. ठीक है, झाड़ दिया एक दिन को एकदम अच्छे से, and you turn back and you do the same bashing, then you are gone. Okay, you are gone. Never do this mistake. नर्सेस से तो भाई प्रिंसिपल और एमएसवीपी भी पंगे नहीं लेते हैं, तो तुम लोग क्यों लेने जा रहे हो? The union of nurses is very much strong, and if you are caught, if they target you, then the whole union would be against you, and if they stop working, you know what happens in the hospital. So be careful from the nurses. Even if they complain, the complaint could reach to your principal also, and they are also means afraid of nurses, and they टेक नर्सेस ऑन देयर हेड, मतलब वो लोग भी सर पे चढ़ा के रखते हैं, ये मैंने देखा है, एंड सब हॉस्पिटल्स में ही ट्रू है ये वाला बात. एंड ग्रुप डी स्टाफ, if you give them basic respect, like if you greet them, remember their name, then they would keep you in their head. Okay, so वो लोग कोई भी काम में आ जाएंगे, किसी के साथ झमेला हो गया, मारपीट हो गया, ग्रुप डी भैया को बोलो, वो एकदम 100-200 लोग जुगाड़ करके ला के देंगे. So that is the advantage, and you would have a good working environment. That is most important. If you have a good working environment, then you are less likely to leave the stream. Finances, you should start thinking about the finances. You are getting a handsome amount of salary, or you are getting pennies like me. From 50,000 to 1 lakh is the range, but you should start investing. Invest in assets, not in liabilities. Liabilities is something that's value is depreciating, and asset is something that's value is increasing day by day. Using your asset, increase your money, and with that buy some liability. That is the main funda of the financial intelligence. So you should invest in assets like real estate, stocks. These are difficult to understand. What I personally do is that you can invest in souvenir gold bonds, because the gold price is rising like hell, and it is going to rise in future also, so it is very much safe to invest in souvenir gold bonds. And debt mutual funds, they give very less margin, about 8 to 13% you can get, but it is good for beginners. And if you want to play more safe, then go for fixed deposits. Okay, but do some kind of investment and LIC policies, even to escape the taxes, the TDS deductions they are doing. You could escape a bit of that if you do some provident fund, LIC and all. We can talk in details about this last three topics in a separate video also. Number 5 is that make your online presence, because the future market is via the social media. In future, patients would come to you by seeing you in the social media only. Those doctors who are having a good social media presence, they would only mainly pull the patients. Now the media is social media, so you can open any kind of social media. YouTube is a bit difficult and is a bit depressing, because it takes times to gain the subscribers and gain the views. You can start with Instagram, it has a good growth potential, and also Facebook. Try to learn AI, because AI would eat a lot of job. Not just AI, but the person who is learning AI would take the jobs, and it would make you a smarter doctor. Like I heard an example in a reel only, that a child was suffering and no of the doctors could make a specific diagnosis. They were giving just symptomatic treatment and telling, but the patient's condition was not improving. After that, the mother did AI search using chat GPT, compiling all the symptoms, and it gave a real diagnosis. After that, they went to a doctor, and he matched and found out that yes, the diagnosis was correct. So like this, you should try to use AI also. How much you can use? Now it is not that much accurate, I would say. It is in a learning model, not in a super learning model, which would have a capability of that of humans, but soon it is going to become. So don't miss this opportunity to learn the AI tools, and try to give the MRCP and FRCS exam now only itself. It would help you to improve your bio, improve your CV. These 4 points we would discuss later in a video, because this video is going to become longer. And if you are feeling that your department is toxic, or you are feeling hectic, or anyway you are not liking the department and you can't sustain, if you are feeling and going through depression, then it is always better to quit the stream than quitting life itself. Okay, quitting stream is better than quitting life. Now it is easier said than done. Best thing is you consult a psychiatrist and seek for his or her advice. They could guide you properly, they could counsel you properly, and they could only give you proper medications. Now comment down below which specialty you have joined, and now you can do two videos popping up. One of them is the top medical streams for future. So take care and all the best for your residency.